promoting businesses and organizations to help them reach their full potential. Lighten the path to the success of your business. Enhancing the lives of our listeners by talking about things that matters most. Helping you to shine your light emotionally, mentally, spiritually, socially, and physically. Spreading positive vibes. You've got it locked and you're listening to Light Vibrations, brought to you by Light Communications right here on CBN Radio 90.9 FM. And now your host and our director, Natasha Letson.
Hello, you've got it locked and you're listening to Light Vibrations powered by CBN Radio 90.9 FM and brought to you by Light Communications. I'm your host, Director of Light Communications, Natasha Letson. Today, our program is being sponsored by the Ministry of Health and Social Development, and our guest, Miss Ivy George, focal point for NCDs, will share some vital information about the CHIP program. Welcome, Miss George.
Thank you for having me. I'm happy to be here.
My pleasure is mine. Before we get into the crux, I know you on the show a few weeks back talking about the Complete Health Improvement Program, CHIP. To start us off, just give us a little reminder about what CHIP is and, why is it important?
CHIP stands for Complete Health Improvement Program. It's a lifestyle program that helps to improve health. It helps to prevent, reverse, and manage chronic diseases. And it's a good roadmap for people who might not have a chronic disease, but who will want to improve their health and to maintain it.
Mm-hmm. And we've seen a lot of coverage about the Complete Health Improvement Program in the media lately. How has the feedback been thus far?
I would say that we have been having good feedback. I was very grateful that we were able to have the level of marketing and PR that we had been able to assign to this particular project or program.
Mm-hmm. And who are some of your backers? Who are some of the people that have jumped on board and, in essence, trying to assist you with broadening that scope?
Well, the program we have some multi-stakeholders, and the people who have been helping us thus far are, we have 284 Media. Mr. Grant is one of our partners. We have Mr. Cromwell Smith, who is a part of he's actually the acting chair of the BVI Health and Wellness Council. And so he has been giving us quite a bit of coverage on his show. And then we have also the Rotary Club has been assisting us, and the BVI Diabetes Association. We also have some physicians that are helping us as well. And so we have the CHIP facilitators that we try to organize in a way that they also will be able to have vital input in the program. And there are some others, people that are willing, but we have not quite formalized those as yet. We have reached out to the food industry, some of the supermarkets, but then COVID-19 came, and so they are still trying to wrap their hands around that. But we are looking at also not only educating individuals, but we also want to make sure that the built environment will support their efforts.
Definitely. And as you said, the food industry, I know that when it comes to healthy eating and, getting yourself with the requisite fruits and vegetables and, all the nutritional intakes that you would need to help to reduce your vulnerability to non-communicable diseases, chronic non-communicable diseases, what you put in your body is very important. And to have because I'm kind of understanding with supermarkets would be key because you'll be able to get, because these foods normally ain't really that affordable to the masses. But in the case of that, just based on what we've seen in the past, when you do try to give reduced taxes or whatever you do with the supermarkets to be able to afford the consumers a lower price, you don't see that transference. So are you guys going to put anything in place to ensure that whatever benefits will be given to supermarkets to ensure that the consumers are benefiting, that it actually transfers?
Well, you put the shoe on my foot, but I'm going to put it back on the consumer foot, because actually the whole idea about how we are trying to use CHIP in the Virgin Islands is that we are trying to use CHIP as a movement to empower people at the community level, so that they want to take responsibility for their health. We want to train them, and by the information that they will learn, so that they could become active and advocate for things that they need. Mm-hmm. And so that is so what we are seeing. This is as a grassroots movement. Yes, government has taken the lead to help to get it established, etc. But in terms of long-term sustainability and the impact this type of program can have, you really need the people who go through the program and other people in the community really come together and begin to advocate in a good way for what they think they want. We don't do that enough here in a good way.
All right, and what if you mentioned also the built environment? Speak a bit about the built environment and how important that is to the entire program.
Well, like I said, when I said the built environment, I was including the fact too that people will need. Okay, one of the things that people will always say, as soon as you say health, they talk about the food. And so the built environment will be, yes, we will want to work with people who are in the food industry, both restaurants and people who are in, like I'm saying, in the retail. Mm-hmm. But we also want to encourage and the local farmers, but we also want to encourage people to get involved in having a little backyard garden on your porch, in a pan, whatever, so that you too can contribute and cut down on your food bill by being able to have certain simple things that grow very quickly and will be very vital, and it will help you.
And definitely since the onset of COVID and this pandemic that we're currently in, I've seen where people are definitely jumping on board with, trying to grow their own foods, trying to,
yes,
start a little garden. So is, things like that a part of the program, a part of the CHIP program?
Well, we don't, in the CHIP program per se, we talk about the food, but after the CHIP program, what happened is people remain in that program for a year, and they will continue to meet once a week, and in that other part is where you will have more, have more food. They might say, okay, I think we would like something at food demonstration. We would like to get somebody to talk to us about how to do a backyard garden and those kind of things. So in that other part of it is where you will have resource person available to them to be able to help them in those type of areas.
Mm-hmm. And since the last time we spoke, where are we right now with the program?
Well, right now we are at the place where we are implementing the classes. We had 6 classes scheduled. Well, there's one that we are still doing some negotiation around, but we have a class in Easton. Easton was the Easton Longlow community. Mm-hmm. They're up and running, so they already had maybe about 2 or 3 classes.
Wow. Mm-hmm.
And then with the next one to come on board is Central. So what we have done, we developed the islands. Mm-hmm. So we have East, we have Central and we have the West. So Central, which would be like Rotong, Purcell, Hunton Gut, around Bargas Bay and so we have a central class, and this central class is meeting in the Gertrude Warner Community Center in Purcell, and it will be their first class will be on Monday
The 13th?
Yes. So the facilitators there are Miss Pinnock, Miss Wanda Pinnock, and Miss Julia Benjamin. They are running that class. In Easton, the class is being run by Miss Arona Forbes, Forbes, and Miss June Penn. Then we go to Virgin Gorda, and in Virgin Gorda, their class should also, I think, start next Tuesday, and we will have a Miss Antoine Matthew and Miss Denim. I can't remember Miss Demin first name, but they are going to be the facilitators running the class in the Valley Virgin Gorda. The other class that we are looking at, we have an online class, and the online class is being facilitated by Miss Terry Benjamin and Miss Maureen Creaky, Miss Maureen Smith Creaky, and their class should start next Thursday, I think.
Wow.
And so we had a class scheduled on Jocelyn Dyke as well. So there is a little, so we are still trying to sort that out to see if we can save that class.
Wow. And so do you expect to have any in the West and other areas, or for right now this is what you're
so
doing?
our cohort this is our first cohort, and that's it, and it's closed. We are not taking any more applications for these classes. We will take, if people send an application in, we will put it on file, and it will be for the next cohort, which will be, we are also because of the weather situation and so forth, we will mostly run our classes. I'm recommending that we run our classes between January to June. July is graduation, August and people leave traveling, and then September and October, due to weather conditions, I don't think it would be wise to try to put classes during that period. So we will train and have classes the first part, and then we'll use the second part to do kick off our monthly parts, and also we always have to evaluate, regroup, and start advertising to pick up the next set of classes.
Okay, but seeing that now you started in July, how long would this cohort go for?
This class will end up running into September, unfortunately. Well, we are thinking that a lot of people might not travel because of the COVID situation, but under normal circumstances, running classes in August will not be a good thing, because we know what the situation is, and we know actually even in terms of the graduation, and so
And what was your max capacity of all your classes filled, as to why you're not accepting any more applications?
They're not necessarily filled, because like I'm saying, because of the COVID situation, some people are still with the social distancing. Well, we could only, for example, in Easton, we were trying to do like maybe at 20, so we had to stop because of the room that we have could only hold, we have 17 person in that class. Now the one in Purcell, we could have hold a little more, but because we haven't reached that quota, I'm saying we have to cut it off, because there's certain administration things that needs to happen. So we wouldn't take any more. So we have closed in terms of people getting into classes for this year.
Okay, so you were pleased with, the amount of applicants you had and the persons who expressed interest in the program?
Yes, for a starter, and because what we are really wanting is that we know that what after the first cohort, then people will be able to say, I take this class, this was what was good about it, and help us to refine it, and we will get some advocate. We are dependent, because you're going to be dependent on advocates and people who go through the course to recommend it to their friends, etc., etc.
And how often will they be meeting?
Which they meet once a week for 2 hours. The ones that are face to face, and the virtual one, I think they meet for like 45 minutes once a week, twice a week they are meeting.
Now, you noted that the one in Easton have already started. Have you been getting any feedback, yes, as to what the participants are thinking so far about the course?
Well, we have been having some good reports. One of the things that they promote in the class is plant-based. We are not telling people that they have to become vegetarians. We are introducing them to certain, and of course, and this is, I think sometimes it's a myth, but be it as it is, that people, once you start to talk about plant-based, people think that it's very expensive. And I can say yes. Yes, for example, for me now, because I also try to do quite a bit of organic stuff, it costs a little bit more, but that's a choice I have made. But also too, I know that some of the other things are not so expensive. It's a matter of being creative and how to do it. Because, for example, before I switched so much to organic, I'm just going to give an example. I would buy things like when they have sale, like peppers and certain things, and I'll just cut them up and put them in my freezer. So I buy when they were at a reasonable price, and most of the time I will still have, I still do a certain amount of fresh things, like for my salads and stuff like that. So I might have carrots that I have cut up for soups and for stir fries and so, but then I would also have fresh carrots, because for my salads and other things, onions and peppers and all of those things, I will just cut them up. Even a lot of vegetables, some fruits and everything, I just
incorporate.
Yeah,
definitely being creative is central to that plant-based life. And cooking your own food is another one.
Yes, and so it's a matter of
So I noted that the District 7 Rep, Honorable Natalia Wheatley, he was offering scholarships for persons in his district who wanted to take part in the CHIP program. Do you think that had any impact as to why that section, is up front running right now? They already had classes, you already up and going, they had assistants. What role did that play, you think?
Well, two things. The assistant helped, but also the facilitators also in that area, from the get-go, they were just out and around. They really just took it seriously, and they just went to town with it. The minister has also put in place, the Minister of Health has put in place a situation where they will be offering grants to all the communities. They're offering, all the districts will have a grant of $150 that people will be able to apply for. And we were also very fortunate to get the government grants are $150, and we have also have some grants from the Rotary Club. The 70-20 district has given us $10,000 towards 100 grants of $100 each. So we are using those 2 grants at this particular time.
So would you say that the persons now who are enrolled in the course are mostly funded by these grants? Are people taking advantage of these grant
Yes,
opportunities?
some person, yeah, there are people who are taking advantage, and there are also people who are paying the full fee.
And what's that fee again?
$200 per class.
So once this cohort is finished, it is the hope of the ministry to have one start again, cohort number 2 in January.
Yes, we will run about probably 2 more class. We'll run 2 classes there. And when we run them, like I'm saying, we will do them in several areas, plus online as well, so that we give people a fair chance.
Definitely. So where do you see the future of CHIP?
Well, originally what we have done is that we had signed up with a contract with Lifestyle Medicine for 2 years, because we want to see if this would be something that would be good for us, in terms of what we really want is to begin to see the numbers decreasing. Now 2 years is not enough, maybe 5 might be better, but we will need to see. And so one of the things that we try to set up the program is so that they have a revolving fund. Then that is why we are charging. We are not trying to make a profit. All we want to do is to make sure that there's always fund there to buy the material that has to be used in the class, and so that government don't have to keep having to put that out. And so that is why this is set up in this way, that people pay, and then that money will be used to replenish the kit. That is the biggest overhead that we have so far.
So do you truly believe that this program would allow us collectively as a society to reach our goal of reducing NCDs, to improving health? Do you really see that it will have a huge impact?
It can, and it's not this alone, because like I said, as I mentioned before, CHIP is a behavior change program. It takes 10 to 12 weeks. Not everybody is ready for that, and not everybody wants to do that. So we also, for example, we want to work with the churches to do church health. We also want to offer, there's another program that I've been looking at, the Blue Zone, which is it's simpler with some challenges and stuff like that. But we want to really get the community up more involved, and they doing things, because the government are doing some things, but the community, there are things that the community can do, and this is what we want. Like I'm saying, with the CHIP program, these are things that I see community people taking an effort on their part, and so government can concentrate more on some of the other things, the bigger things that we need to be concentrating on, the legislation, having the quality of services, and having working with some of our stakeholders, like I said, with the supermarkets, with the other places. Those are things that government can do that and there are some like the legislations, and so these are things that the government have to do. But if we are we can't do, we have such limited staff. If we have to try to enable and empower other groups to be able to do some of the other things that they can do. So
I definitely agree with you. Empower the people to help themselves.
Yes,
definitely.
Yes.
Do you have any success stories you'd like to share with us?
Well, one of the good things I want to say is that I have been looking at CHIP for a very, very long time. And it, because I'm saying, when you're making recommendation for a population-based program, you really have to weigh a lot of things. And well, it might have been, it would have been nice for me to have been able to develop a nice homegrown program from scratch for us. like I said, with 1 person or 2 person a unit, I didn't have that luxury. So the best other thing was to find something that could be done, that is reputable, that has been scientifically based, that has had results, and and it is set up in such a way that other people can use it and can help you to implement it. And this is why we choose CHIP. And I want to say to you, I'm glad that we did, because I think 2 weeks ago, CHIP was the first program. There are several other programs like that, but CHIP was the first one in the United States to be certified by the American College of Lifestyle Medicine, and that's a great achievement. So we now are, I'm saying this is something now that they are saying that yes, this program is doing what it say it can do, so we can put our seal of endorsement on it.
Wonderful. Final thoughts?
Yes. My final thought is that I would like to encourage our people to do whatever they can to stay as healthy as they can. I want them to know that they don't have to become one of the statistics when it comes to NCDs, because we now know that NCDs can be prevented, they can be controlled, and they can be reversed. So we want for people to take advantage of these opportunities. And another important thing I want to say, that I want to remind people that CHIP is an education program. So if you enter a CHIP program, we want you to work with your care provider, your physician, or whoever is on that team. And what it will help you doing a program like CHIP should help you to do is to be a better partner with your provider in your care. So you don't just decide that you're not going to take your medication or you're not going to follow. No. You are supposed to inform your provider that you're part of this program, and then you and your provider should be continuing with your care. But what I'm saying, what a program like that will help you to be, is you are now in a better position to be to take active part in your care. And so that's one of the things. I also want people to know that CHIP is not a vegetarian or vegan diet. Some people do gravitate because they want to change, but there are other things. It's a holistic program that deals with body, spirit, and soul. And so I need for them to know that it's not a quick fix. And even long after you come out of the program, we will hope that you will continue to use your material to help you to stay on track, to share with your friends, etc. Another thing that a lot of people have been asking is when they are finished, if then they will be a certified facilitator and can run program. No, we don't have that kind of authority. CHIP is the lifestyle medicine is the one who certify CHIP facilitators, and right now we will not be certifying other CHIP facilitator at this time, because we certify 23 facilitators and we have enough right now. So I just want to share that as well. When you take the program, what we are expecting is that it will empower you to be able to take better control of your health, and if in some cases where it's a mother, that she can influence the health of her husband and her children or significant others, etc., and even people in your community, in your workplaces.
Well, thank you so much. As always, it's a pleasure to have you on the program, Ms. George.
Thank you as well.
I want to thank Ms. Josh for coming on the program today to share this vital information about the Complete Health Improvement Program that is being implemented by the Ministry of Health and Social Development. For more information, interested persons can call 468-4936 or email chipvirginislands@gmail.com or visit the website www.chiphealth.com. Together, let's press forward towards a healthier Virgin Islands. You've been listening to Light Vibrations, and I'm your host, Natasha Letsom, saying thank you for tuning in and blessings.
Thank you for tuning in to Light Vibration, and don't forget to tune in this time next week as we continue to bring you life-changing information. Until next time, shine your light.